In this video, we'll be discussing as to how chemotherapy helps in rectal cancer treatment. As you all know, chemotherapy is an important part of cancer treatment. It helps in curing cancer. But we need to understand how chemotherapy helps in rectal cancer treatment. Firstly, it is used for shrinking the cancer before surgery. Many patients come with very large tumors, and there is a risk of leaving behind cancer tissue in the primary area if we directly operate. In these case scenarios, we give chemotherapy to shrink the tumor to get to a size which we can operate. Secondly, chemotherapy targets cancer cells throughout the body. There are situations wherein the cancer cells have spread to other organs. When they are visible, we call it stage 4, but when it is not visible, we assume it is a lower stage. But still, we want to give some chemotherapy in order to kill those minute cells which are spread somewhere else in the body. So it takes care of those cells before surgery so that we can go into a clear area and operate when we are performing the surgery. Third important function of chemotherapy in rectal cancer is to enhance the effectiveness of radiotherapy that we are giving. So it's called radiosensitizing effect. What it does is it helps radiation to kill cancer cells in a better manner. So the results of radiation improves because we are adding chemotherapy along with it. Fourth important function of chemotherapy is to clean up after surgery. Basically, what it does is it targets the remaining cells in the body which are invisible to any scan, any other form of test. It targets those cells and it kills those cells and improves the survival for the patient. So, in this video, we have discussed 4 important functions that chemotherapy performs for a rectal cancer patient. Thank you.